Hi, I'm Jill Carson. I'm a consultant in public policy with Alzheimer Scotland, and together with my colleague Lynn Flannigan, who's a senior improvement advisor with Healthcare Improvement Scotland, we're going to describe a coordinated approach to post-diagnostic support and look at the critical success factors associated with that. So the third National Dementia Strategy for Scotland was published in June 2017, and it signifies a shift in the post-diagnostic support commitment made by Scottish Government, whereby it now puts greater emphasis on promoting and supporting flexible post-diagnostic support services. People who are judged to have a higher level of post-diagnostic support need should fall into the scope of a more coordinated approach. Diagnosis was paused across most of Scotland at the height of the pandemic. Therefore, less people received a diagnosis. This was variable, but it was significant. There are now reported long waits for diagnosis, and therefore people are often at a later stage when diagnosed. People are also reluctant to come forward, and as we know, social supports have been significantly limited. Added to the fact that more people are diagnosed in their 80s than at any other age, and are thus more likely to have more comorbidities, and all of that together means that coordination of care is critical to avoid negative outcomes such as early admission to long-term care and crisis hospital admissions. So what do we mean by care coordination? Well, it can mean different things to different people, and it's a term which is broad and relatively ill-defined. But this is a good definition from the World Health Organization, which is a proactive approach to bringing together care professionals and providers to meet the needs of service users to ensure that they receive integrated, person-focused care across various settings. As part of the work that we've done, we've been on a journey to better understand what care coordination actually is, the practices associated with it, and the outcomes for individuals in health and for health and social care services. So we conducted an evidence summary in a webinar, which can be found on the Focus on Dementia web pages. Needless to say, we did find that effective care coordination can lead to positive outcomes for people living with dementia and their carers, and it also had benefits to health and social care. Midlothian, which is a small area in Scotland which serves a population of about 90,000, was a test site for a coordinated approach to supporting people whose dementia is progressing. We took an appreciative inquiry approach to looking at what they did, and that showed positive results. It showed that the overall resource costs for people with dementia in Midlothian are significantly lower than in other health and social care partnerships in surrounding areas. Also, the bed day rate for people with dementia following unplanned admission was significantly lower than in other neighbouring areas. And that means not just a significant cost saving, but also a reduction in the risks to people from unnecessary time spent in hospital. People with dementia in Midlothian are also significantly less likely to die in hospital compared to other areas nearby. And data analysis suggests that a higher proportion of people with dementia are diagnosed and identified in Midlothian. We wanted to understand what critical success factors contributed to these positive outcomes for people with dementia in Midlothian.
From this work, we extrapolated 12 critical success factors for care coordination and have since developed a self-assessment for services and organisations. All of the information from this work, the reports, the critical success factor self-assessment and an animation can be found on our web pages. We are now implementing this learning and are working with a health and social care partnership through our Scottish Government Commission Care Coordination Programme, which aims to support improvements and redesign of community-based services to improve the experience, safety and coordination of care, services and support for people with dementia from diagnosis to end of life. The emphasis on supporting people to stay well at home or in a homely setting for as long as possible. Inverclyde Health and Social Care Partnership were chosen as our site after an application and selection process. Everyone's journey with dementia is different, but this whole pathway approach has really helped us to identify areas for improvement across the whole pathway and to make sure there is person-centred planning for people with dementia from their diagnosis to end of life. We are now working through a 14-page action plan, working on improvements across the whole pathway. And we weren't starting this work from scratch with this work because we had previous learning from the testing of the Alzheimer Scotland 5-pillar model of post-diagnostic support, which is now well established in practice. And we've also had learning from the 8 pillars model of care coordination testing. There has been less previous testing of the advanced dementia practice model, so that has been an essential part of this commission. This work will conclude end of March 2022, after which there will be an external evaluation of the programme. We will then develop a change package with all of our learning, which we look to spread across Scotland. If you would like to get in touch or would like to follow our work, please contact us directly, check out the Focus on Dementia website, or follow us on Twitter. Thank you.